from Fulton and DeKalb boards of health. Anyone that does have a question that's in the audience, we have a roaming mic that you can ask the question on microphone. So stand by, folks.
All right, good afternoon. I'd like to welcome everyone to the Fulton County Government Center for this press conference. I'm Rob Pitts. I chair the Board of Commissioners. I'm joined today by the County Manager, Dick Anderson, our Chief Operating Officer, Ms. Anna Roach, and our Chief Financial Officer, Sharon Whitmore, and Dr. Sandra Ford, the Interim Director of the Fulton County Department of Health. We've met this morning, and we started meeting late yesterday, as a matter of fact, and we've talked during the evening trying to monitor the situation that is occurring, not only nationally but internationally, but more importantly now in our county. And we've assembled the senior management team. We've gotten a plan in place. We've did an assessment of county facilities, including the Assembly Hall here, our jail, jury rooms, and the criminal justice system, senior centers, including our library. So we're on top of the situation, and my main message, though, is for the citizens of Fulton County to remain calm, follow instructions, as we will be following instructions, and we'll be taking our cue from CDC and the state of Georgia. And our leader in this effort is Dr. Ford, who is the interim director of the Fulton County Department of Health. So I'll turn it over to her so she can speak from a medical point of view about the situation in Fulton County. Dr. Ford.
Thank you. Good afternoon. I'd first like to just provide what information we do have about the 2 cases of coronavirus, COVID-19, that are currently present in Fulton County. A traveler 56-year-old male, came from Milan on February 22nd, was asymptomatic upon landing here at Hartsfield. Several days later became symptomatic. 2 days after that, on the 27th, his son also became symptomatic. Both presented to their physician, who notified CDC of the adult's history of travel. CDC collected specimens and tested them, and both the adult and the child have tested positive for COVID-19. They are currently being isolated in place in their home. There is a spouse and a younger child who have also been exposed, and we are currently in the process of testing those individuals as well. The adult male's symptoms have resided. He's asymptomatic at this point or has limited symptoms. The child also has limited symptoms. So they are both being monitored at home. The Fulton County Board of Health is calling on a daily basis to assess for symptoms for all individuals in the house. At this point, this is a travel-related COVID-19. Our messaging is the same. We're trying to create prevention messaging, not panic messaging. And so the message is the same: to continue good hand sanitation, washing your hands frequently. If you cough into your elbow, and still wash your hands whenever you touch surfaces. Keep surfaces clean, and do not go to work or school when you are ill. Any questions?
Dr. Ford, you said the gentleman came home and he did not have symptoms, so that means he must have obviously gone through Hartsfield-Jackson Airport. Are we testing?
Well, at the time that he landed, he was asymptomatic, and so at this point, we are not concerned about travelers.
Do you know his flight path? Last night we weren't sure if there was a layover or what his travel path had been. Can you explain where he came from when he was on?
So the question is where he came from. I believe that he went from Milan to Amsterdam and then to Hartsfield.
Do you know the exact dates of each of those stops?
I believe all that travel took place on the same day, which is February 22nd.
So when you say asymptomatic, does that mean people on the flights with him did not run the risk of catching the coronavirus from him?
At this point, according to the CDC, the infectivity rate occurs when the patients become symptomatic. So his symptoms became on the February 25th.
Doctor, can you give us some idea as to what city, what part of Fulton County these individuals live in who either have been confirmed cases here in Georgia or who are right now being tested at that home? And what, if any, contact any of those individuals may have had with others in the community? Are schools being contacted? Other businesses being contacted where these individuals work? Could you detail, please, what other steps are being taken?
Out of privacy, we do not disclose specific locations of infected individuals. However, I will say that the students, the two children, are homeschooled. So Fulton County and Atlanta Public Schools are not impacted by this.
Can you detail whether or not any specific businesses may have been impacted or are being impacted as a result? Or, the grocery stores, just if you could just allay any concerns individuals might have as a result of this, or even if you cannot say exactly what city, if you can give folks a general idea as far as North Fulton, South Fulton, just a general area.
I cannot. I would say it's general Fulton County. They went straight home after going from the airport. Shortly after he arrived, he began to become symptomatic and thought about his history of travel and was also notified that other individuals at the same conference that he was at in Milan had tested positive for COVID. So he immediately went to a physician and was tested.
So Fulton County health officials can say with certainty that, as far as you all are aware, none of the people who may or have been exposed in that home had any contact with individuals outside of that home who would need to be tested in Georgia or in Fulton County.
No, I cannot say that. We are in the process of doing a contact investigation as we speak.
Doctor, as far as the other people in the home, I know the test results for the two that tested positive. I think the state said those went in on Saturday to the CDC. They had test results last night. Do we have a timeline for those two other people in the home of their test results? Do we expect a similar turnaround?
That would be my hope, yes.
And as far as following up here, just to confirm, so other people on the plane are not being contacted. I know the CDC says the risk is low, but there still is an opportunity for an asymptomatic person to spread the virus while it's low. Just out of abundance of caution, no one else on the plane is being contacted?
The recommendations from CDC were that the travelers on the plane did not need to be tested at this time.
Dr. Ford, did this man go to a local private physician's office or a hospital? There has been communication that I'd like you to either confirm or debunk about the Sandy Springs area, Northside Hospital potentially taking him in. Could you explain where this patient went when he became symptomatic?
This patient went to a private physician's office where he and his son were both tested at the same time.
Any Northside involvement?
No.
Doctor, as far as the greater public out there, we hear from a lot of our viewers and they say, maybe I have coronavirus. I know the risk is very low, but the flu is going around, the cold is going around. Can you just break down when should people be checked out for anything, and just sort of, is there specific differences between those short of your travel history?
Yes, thank you for mentioning that. The flu is a much more deadly virus for us right now, and I don't want to underemphasize that. There are 1 million cases of flu worldwide. Coronavirus is at about 90,000. Fulton County right now has a pretty dramatic mortality from the flu. We've lost several people from the flu already this year. The symptoms are similar. With coronavirus, you have more of a cough and a fever. With the flu, you have more body aches with your fever, but they're very similar. And so that's our messaging, is the same precautions we take to prevent influenza are the same precautions that we should take to prevent COVID-19 and all other infectious diseases.
Dr. Ford, last night Governor Kemp said that there is a plan in place, it's working. Could you share some light on who reports to who, what agency responds first? What's the organizational and agency structure here on this plan that the governor mentioned?
Sure. As it relates to COVID-19, first, the screening takes place at the airport. Those that are symptomatic are monitored more closely. Staff are actually sent to their home to monitor them. They're still being monitored in-house at this point. Those that are asymptomatic but exposed are allowed to call in or fill out an electronic form through the email.
Where would they get that form from?
The form is provided through the Department of Public Health.
Dr. Ford, want to expand?
Can we allow this to be the last question? Also, I want to introduce you to the superintendent of Fulton County Public Schools. He's here as well for comment, but let this be the last question, and you can get folks after this.
Dr. Ford, are we expanding the people who are being screened at the airport? I know there were a lot of flights coming in from Asian countries that were initially being screening, passengers were being screened. Are now we expanding that to other international flights as well?
I do not know that at this time, and here's the thing with that: this person arrived and was asymptomatic, and so screening is not, at the airport, is not 100% effective anyway. It's best to just monitor your symptoms and report to a physician if you're at all suspicious and you've had that history of travel. The screening at the airport is only one method.
Just to clarify, you said he landed on the 22nd, was symptomatic on the 25th, all of February?
Correct.
Thank you all.
Thank you.
Thank you very much.
Dr. Ford, if I could just follow up with you, ma'am.